Hi and welcome to your next unit. Today we'll be discussing HLTWHS002, which is Follow Safe Work Practices for Direct Client Care. Your organisational policies should clarify objectives for the achievement of health and safety standards, details of steps that should be taken to maintain a health and safety environment, schedules for the completion of health and safety objectives, and details of how policies should be reviewed and the specific responsibilities of managers and other staff members. You may have organisational procedures for dealing with aggressive or potentially dangerous behaviour, organising evacuations, inspecting and monitoring the workplace, and training and reviewing knowledge of employees. When it comes down to legal responsibilities, it is up to you as an employer of the organisation, along with your colleagues and managers, to ensure that the organisation is a safe environment for all of those people that are going to be in it. So it's not only just for your clients and their visitors, it is also for yourself as a staff member and for your colleagues that you work with. So each person has a set of responsibilities within themselves that they need to ensure that they tell a supervisor or bring it to someone's attention if they find that there's a health or safety matter that needs to be addressed. Employers must provide their staff with a safe premises, safe machinery and materials. So this could include anything from a slide sheet to a hoist, safe systems of work, information, instruction, training and supervision. So this would be also with the equipment that you need to use, and a suitable working environment and facility. Infection control. So infection control covers all your PPE or personal protective equipment. So this also includes your gloves, your eyewear, your face masks, your aprons, your booties. When you have identified a risk of infection, it is your duty as a support worker to respond to them in according to the policies and procedures of which you work under within your organisation. There is also state legislation and national standards that you also need to adhere to. Think about where you can eliminate any risks or hazards. If you can eliminate them yourself, do so immediately so that doesn't pose a risk or harm to someone else that could come into the environment. If it's something that you can't remove yourself, take it to your supervisor or put it into a maintenance communication book so that it can be removed in a timely manner. Identifying hazards and risks. Health and safety hazards may be apparent in numerous areas of the work environment. There will be different levels of risks associated with each of these hazards. You are advised to carry out regular inspections and identify signs of danger. Some hazards and long-term risks may not be immediately obvious. However, research can be undertaken and employees asked for details of any concerns. You may arrange for following consultation. So this is where we can have toolbox talks or even just a general staff meeting. So within these toolbox talks or staff meetings, this is where you can bring up any issues or concerns that you may be having around your WHS issues. So if you are identifying any risks or hazards within the workplace, this is a great area to bring them to attention. Sources of risk to personal safety. These can include alcohol and drug use. There is absolutely zero tolerance for coming to work under the influence of alcohol or drugs, and we also do not tolerate any of the other staff that are coming in under the influence of alcohol or drugs. So if this has been brought to your attention, it is your responsibility to take it to your supervisor immediately. This can cause behaviours of concern. There are risks associated with access to work, access to private homes, and the performance of work. Incident reports may be used to identify situations with a high risk of threat and client related. So this is where we can fill out, if we are finding that there are particular threats in place, we can fill out an incident report form and say that there was a near miss due to a particular risk or hazard. We don't have to only just fill out incident report forms when something has already happened. Working in new, isolated or potentially unstable environments. So if you're working out in the community and you're going to people's homes that you may not have necessarily been there before, it's up to you as your support worker to go through and familiarise yourself with your own environment and surroundings and know what could be the potential risks and hazards at that site. Workplace hazards. So these are broken down into a couple of subcategories. Biological hazards, which include body fluids, contaminated food, soiled clothing and linen, clinical waste, syringes or other sharps. Chemicals, such as toxic or hazardous substances, gases and liquids under pressure, and certain cleaning chemicals. There's electrical hazards related to the use of equipment and faulty wiring, and equipment including suitability for purpose and fitness for use. Following on from there, we go into personal threat, such as though behaviours of concerns from clients or their visitors. Work organisation issues such as shift work or irregular hours or being on call. Work-related environment such as underfoot, lighting, space, noise, air quality, furniture, fittings and car parking, or work-related stresses. So there's different types of risks. There's an environmental risk. So this is caused by the threats from your physical environment, such as trip hazards, fire hazards, loose mats, electrical cords laying around. Then we have client-based threats. So this is coming from clients that display violent behaviour or physically aggressive behaviour towards yourself or someone that you're caring for. There may be an infection of risk or injury sustained while assisting with these clients or helping to move them away from potentially aggressive situations. There's staff base. This can range from other staff being violent or unfit for work. Staff should be monitored and trained in preparation for these events. People-based. This involves other people that can range from the client's families and general public and can also cause numerous risks from infection to a person's dog being out of control. So let's discuss our communication method. As I've said in previous units, there's lots of different ways that we can communicate. So obviously we can verbally inform our supervisors or our colleagues about changes and what's going on in our environment or clients. We can also write this down in clients' progress notes or communication books. We can notify staff during handover. We can also have written notes, memos, emails and report forms. And we can also call our other staff and supervisors on the phone if we're working out in the community. Factors that should be taken into consideration. So the times at which there is a significant risk of a challenging behaviour. This needs to be taken into consideration if it's the time of day that your particular client displays such triggers. The environments in which employees and customers are at the greatest risk. So this is when you're going out and working in the community and you're going to a new client's home. It's an unfamiliar environment, so this is going to pose a higher risk than those clients that you see on a regular basis. The arrangement and allocation of resources to help employees deal with aggressive behaviour. So this can be done through in-house training or also through professional development within your organisation. Opportunities for training staff in different ways to minimise risk and overcoming challenging behaviour. So this can be sitting down as a staff meeting and identifying people's weaks and strengths and utilising the staff that you have and to identify overcoming challenging behaviour. You may have some staff that are more robust and feeling more comfortable and going forward to tackle on this type of behaviour rather than you'll have more quiet, subdued staff that won't feel as comfortable. Employees should know how to identify signs of behavioural change and aggression, monitor and deal with various challenging scenarios in the workplace, negotiate and establish reasonable limits in response to concerning behaviours, decide which actions to take as a consequence of the challenging behaviour. Deal with distressed and angry customers. So first and foremost, we want to try and calm the situation. So we're going to use our body language, we're going to use the pitch and tone of our voice, we're going to be apologetic of whatever the situation has posed for the client or their family. We're also going to validate how they feel and show empathy and understanding on how they feel and let them know that it's okay to feel that way. We need to accept responsibility and identify means of assistance. Incidents or suspicions. So this is where we may have suspicions of abuse or assault that could be happening to our clients or their loved ones. We could identify where there has been neglect that has taken place. Staff that are unfit for work through drinking or taking drugs, or through being tired and burnt out, or through the lack of training. Sexual misconduct. So this is where you can identify inappropriate relationships between staff and clients or between clients themselves. You need to have two consenting parties to have a sexual relationship. So if you have two clients and one client is consenting and the other is not, that is going to pose an issue that you need to take to your supervisor for him or her to be able to take charge of that. There's also an issue about missing residents. A lot of our clients are in the stages of having dementia, though they're not in a secure environment, so they're happy to come and go from the facility as they please. As the dementia progresses in your clients, they will need to be provided with more assistance in coming back to the organisation, as their memory does tend to fade further and further away with the progression. So just be sure that you take extra close eye on those types of clients. Who can we report our workplace hazards to, and how can we report them? So first and foremost, if you have any workplace hazards or incidents that you're concerned about, please feel free to take them to your supervisor. There will also be a communication book that you can write down any WHS issues that will go to a maintenance person to address as well. You can do this by telling them face to face, and you can also back it up with a written report. We can do this by sending through memos, emails or notes, or putting our notes down in a communication book. Health and safety policies. So these are created specifically for the organisation and the site that you work at. You may work in a large organisation that goes across numerous sites, and each site will have their own manual and policy and procedure around workplace health and safety incidents in that site. So we need to include details on how to manage the different working environments to optimum the safety of the environment for not only yourself and your colleagues, but your clients. There should also be details of the responsibilities designated to different members of the workplace. A lot of these larger organisations will have a workplace health and safety officer. They may have a committee also, and you can take your issues and concerns to them directly. Employees with knowledge of various health and safety issues should contribute to the policy. Health and safety policies should apply to various types of work and be written in accordance with the WHS Act. Methods should be established for the identification and removal of hazards in the workplace, and it is also important to produce response documentation highlighting details of incidents, investigations and notifications and ways of dealing with emergencies. You should be aware of the following causes. As you know, we do a lot of different shift work, so from morning to afternoon to night shift, and you can be placed on numerous different shifts throughout your pay week. So what we need to be aware of is the following. We're going to experience some fatigue with the changes of our shift times, and that in turn is going to bring a bit of stress on. There could be slips, trips or falls due to this, and unsecured objects or aggressive behaviour or unexpected collisions could happen. So what do we do when it comes to dealing with incidents? You should never attempt to deal with a serious incident unless you've been provided the necessary authorisation or training. You should complete the task that you are trained for in accordance with your moral and legal responsibilities. Work instructions may be in a community language, in English, provided visually, for example with WHS signs, any videoing, any symbols. It could be verbally communicated, including care plans associated with risk management, and it also could be down in a written documentation. Manual handling is a big part of being a support worker and your role. As you would know through doing your vocational placement hours, there's a lot of moving of clients around. We do manual handling by using aids that are going to help us. So we're going to have to move numerous clients of numerous shapes and sizes throughout our shift. So we have these aids there to protect ourselves from injury or harm. You will experience using slide sheets, pelican belts, pixel hoists or stand-up hoists, full sling hoists, arjo baths, wheelchairs, wheelie walkers, forearm support walkers. There's a large range of aids that are there to be able to help us as the support workers provide the best possible care to our clients and move them around in a safe and comfortable manner. The risks that come with manual handling. So the risk that associated is that it's going to be a repetitive task that you're going to have to do over your shift. So with anything, whether it's pulling or pushing, lifting, carrying, anything that is going to put any type of strain or stress onto your body is going to have a significant risk. Risk assessment tools. So these are charts and checklists that we use to assess the type of risk in the environment that we're about to put ourselves into. We have a scale of danger. And with that, we put a questionnaire together and we ask ourselves, what can we do to minimise or eliminate the risks and hazards within the environment that we work? Preventing the spread of infection. So as we work with a diverse range of clients within the organisation, we need to be aware that they come with a diverse range of conditions. So we need to ensure that we don't put ourselves in harm or danger of spreading infection. So what do? We use personal protective equipment, also known as PPE. As I mentioned earlier, this could be anything from using your gloves, your eye masks, your face shields, your face shields, your aprons, your booties. But we need to ensure that we're changing these things in between every client. We need to ensure that we're washing our hands in the correct hand technique before and after every client as well. We also need to take into account the additional infection control measures that may be required is if a staff member is sick or a client is sick, if there is an outbreak of a particular virus. If there happens to be an outbreak of a particular virus within your organisation, it is up to your organisation to be able to isolate the staff and the clients to certain sections of that facility so that the infection doesn't get spread throughout. The service user is known to have a serious infection condition such as HIV. This also comes across with your hepatitis A, B, C. If you are treating a client with a particular illness, your immune system is compromised for some reason. A condition has spread amongst the residents, so this could also come from gastroenteritis, commonly known as gastro, or if there's particularly vulnerable clients. So this could be a client that has come out of hospital, it could be an amputee client, and so they're very susceptible of picking up extra infections or germs. We need to ensure that our infection control is at a high level and that we're maintaining the best interest for each and every one of our clients. Infections typically happen in one of several ways. So this could be airborne, so this is through coughing and sneezing, contact through the skin, through shared surfaces, so this is where bodily fluids have been put on one surface, the surface hasn't been cleaned appropriately, and then another staff member has come along and exposed themselves to that surface and it's picked up that way, or through wounds. So you'll have a lot of clients that have a lot of different types of wounds that need to be managed. Once again, we need to ensure that we're wearing our personal protective equipment whilst we're doing wound dressings, and that equipment needs to be changed in between every single client. So good practice, sterilising surfaces and equipment, wearing your personal protective equipment such as your gloves, covering your mouth when sneezing or coughing, Separating contagious people. So once again, this could be with your gastro. It could also be with your MRSA, also known as staph. Be aware of those who are sick and continually washing your hands. From the minute that you get to work to the minute just before you leave work, you'll be washing your hands, washing your hands, washing your hands. I cannot stipulate how important that is to do in between every single client, to do before you go on your break, after you go on your break, after toileting rounds, before dining room time. Every single time you go to a new client, you need to ensure that you are washing your hands and putting your gloves on. Infections that may result from contact with the following sources. So food poisoning, animals, family members, friends and associates, poor housing or poor sanitation. Workplace inspections. So we need to do routine inspections throughout our area that we work and throughout the organisation. So if this is in a facility, there will be designated staff that will carry out these inspections. If you are working in the community sector and you're going out into people's residence, it will be yourself that will be conducting these assessments. Your organisation will provide you with a risk assessment template, and that will be the document that you take out to your client's residence, and you just follow through the template, filling it out in accordance to your organisation's policies and procedures, and that template goes back to your supervisor for review. Structure of incident debriefing. There should be a general agreement regarding attendance at workplace debriefings. Such sessions may begin with details of the agreed measures implemented subsequent to the negative event. Employees should be encouraged to air their views without fear of incrimination. It will also be important to consider the results of follow-up action in light of agreed recovery objectives. Other forms of debriefing. So these sessions aren't always organised. There can be a spontaneous debriefing between you and your supervisor and a third party. Many businesses organise regular debriefings for the purpose of accessing the risk and progression of projects. Employees may be praised and rewarded for setting positive examples in the workplace. So at the end of going through your learner guide, going through your PowerPoint presentation and watching this video with me, you're going to have a set of questions that you need to answer. It's going to entail skill assessments, knowledge assessments and performance assessments. If at any stage throughout answering these questions you're experiencing any difficulties or you don't understand the question, please feel free to contact your trainer directly, and he or she will be more than happy to assist you with your difficulties. Thanks for watching again, guys. Talk soon. Bye.